This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Regina League.
Well, hi, everybody, and welcome to the Good Neighbor Podcast. We are broadcasting here in South Charlotte, and today I have with us the owner and medical director of Derive Health, Dr. Jonathan Leake. Welcome, Jonathan.
Hi, good morning. Thanks for having us.
Absolutely. This is such an interesting topic, and I bet many of our listeners have no idea what you guys do. So let's start first with a little bit about you and the journey of opening Derive Health.
Sure. So again, my name is Jonathan Leake. I'm a emergency medicine physician by training, so ER doctor, as many people call us. And so I became an ER doctor, finished residency in 2008, and then practiced emergency medicine full time for about 13 years. And so, myself and my business partner were working together in the ER. And so we really saw that we were taking care of people when they were sick, when they were run down. And we really started to think about what could we do to help people live healthier lives? How can we kind of, create spaces where people can be pursuing health and wellness instead of just getting sick and then coming and seeing us? And so my business partner, Keith Paris, and I, decided to kind of start on this journey of focusing on health and wellness for our clients. And first opened Hydrate Medical 10 years ago that specializes in IV vitamin infusions. And then almost 2 years ago now, we opened Derive Health to focus on really kind of brain health and brain wellness.
That is amazing. So the therapy you guys focus on is it ketamine? Am I saying that properly?
Yeah, ketamine therapy. Yeah, that's correct.
Ketamine therapy. So what is it, and who and what conditions does it help?
So, ketamine therapy, we really particularly use that word therapy after ketamine. It's not just a ketamine infusion. And so, ketamine is a dissociative anesthetic. It's a medication that's been around for 50 years and is used, in operating rooms and ER rooms around the world today to put people to sleep for brief procedures. But about 10 years ago, kind of by accident, it was discovered that ketamine has really strong antidepressant qualities, and that getting just a few infusions over a series of time can really help boost people's mood, help relieve depression symptoms, help relieve anxiety, and even PTSD symptoms. And so, we're seeing that the infusion helps a lot, but really doing what we call ketamine therapy, where we're doing infusion plus supporting the client and really making sure that they're getting the most out of the treatment, really kind of is the secret sauce to kind of getting the most out of this treatment.
Well, with you guys being medical professionals, I'm just curious, are there businesses out there that don't possibly have the same qualifications? I mean, it sounds like this is such an important aspect that you guys, with your medical ER background.
Yeah, so if you look at ketamine practice across the United States, some people kind of call it the Wild West of ketamine practice. And that, there's really some people that just go and pop up a ketamine infusion clinic. And, what that may look like may be hugely different from what we do. It could be just an IV technician that's starting a drip and giving you an infusion, not really supporting you at all. Not helping you integrate what comes up for you during the infusion, and just not really providing that next level care that we provide at Derive. And so if you're looking for a ketamine treatment, I think that as you're investigating clinics, you should really be looking for that medical professionalism and looking to make sure that there's physicians or nurse practitioners on hand, that those providers have specific training in ketamine therapy, and really kind of know how to handle this as more of a treatment and a therapy than just an infusion.
Can anyone just come in and get this treatment?
So ketamine therapy is really primarily focused on treatment-resistant depression, treatment-resistant anxiety, and PTSD. And so what that means is that, this is for a client that has tried other modalities for therapy and have seen that they didn't work for them. And then, ketamine is kind of the next line for that. So maybe someone that's tried an antidepressant and found that it didn't work for them, or the side effects were too severe, or maybe has tried talk therapy for a year or so and has found that that's not really been beneficial. And that's the one that ketamine could be really good for. And so, what we'd like to see is a referral from a provider, certainly your therapist or whoever's been managing your mental health. And that just lets us get with that person and make sure that we're kind of holding that space for you, that we're really able to kind of work with your current therapist and do what's best for you. However, some clients have kind of found that it's hard to get a referral. And so sometimes we'll see those clients individually and work on kind of screening a little bit more ourselves and making sure that it's safe and a good therapy for you.
So describe what the process is like for the patient. Let's say you get that referral. Well, first of all, you have to even know that this therapy exists, which I think
Right.
is huge. It's new, it sounds a bit cutting edge,
Yeah.
but this is going to open people's eyes to, wow, this could be for me. So let's just talk about the process.
Yeah, so people kind of come to us in a couple ways. One is that they're researching maybe treatment-resistant depression or treatment-resistant anxiety, and then kind of find out about ketamine, and then are looking to see, what providers are available in the area. Others are direct referrals from their physicians, or their therapist who kind of feel like, hey, this may be something you should consider. And so most people end up coming to us through our website. There's a contact form there on derivehealth.com. And, through that contact form, it asks some basic questions to kind of start that screening process. And then our wonderful nurse and ketamine coordinator, Kristen, starts the conversation with you, usually via email or phone call. And that's kind of gathering what your health background is, making sure that this is safe for you from a medical standpoint,
Mhm.
getting that referral and getting all that list together. And then once we have that all set, then we go ahead and schedule your first appointment. And then that first appointment involves a long consultation with one of our, either myself, the physician, or one of our nurse practitioners, and really kind of going through what to expect and what the process is going to be like in preparing you for that first ketamine journey.
So describe that journey,
Yeah.
what that feels like for the patient. I'm so curious.
Yeah, so when you first walk into Derive Health, it's funny. You can see people kind of take this deep breath and just realize that they're in a safe and comfortable place. And people walk in and just go, wow, I feel so at peace here and so calming here. And it really feels like this combination of maybe a beautiful spa or just a beautiful, comfortable living room that you just feel like you can kind of relax and let go. And then knowing that you're surrounded by, health professionals with ER backgrounds that are really going to take care of you and make sure you're safe, just really lets you kind of breathe that relief a little bit more. And so when people come in for their first visit, they sit down in our beautiful lobby and complete, some basic consents and paperwork. And then we walk you back to one of our four beautiful treatment rooms. And so each of these are private rooms that are very private and quiet. And they all have these kind of beautiful leather chases in them that you can kind of sit back and relax. And so we encourage people to kind of sit back, relax, start to kind of settle in. We'll have gentle music going in the background. And then on your first visit, we spend, 30 minutes to an hour really kind of diving into what brings you in, what's going on, reviewing your health history, and then really kind of starting to prepare you for what's ahead and, what ketamine's all about, how it works, and what that journey might be like. And then the infusion's about 40 minutes. It's just
Okay.
a very, very small IV catheter, so just a quick pinch with that, not very severe. Our nurses are awesome at starting IVs, so that's a pretty mild part of it. And then we do noise canceling headphones and kind of eye shades to really help you relax and kind of, enjoy that journey and that process. And then after the infusion, it usually takes about an hour to fully recover, but we really see that's a beautiful time that we can work with you and kind of talk about what maybe came up for you, do a little bit of therapy with you, and really start what we call integration, which is, working with the ketamine medication and starting to talk about what's coming up and how to kind of make lifestyle changes around what's come up for you.
Oh, I didn't realize there was like a talking therapy session as well. That's
Yeah.
amazing. Amazing. What misconceptions are there in this new world of ketamine?
So, I think that there's a lot of questions about safety. And so, people know a lot about, or maybe have heard about ketamine as a street drug, Special K, or has some other street names. And
Oh,
it was
wow.
really used a lot in the club scene in the 80s and 90s. And so people maybe have heard of that and safety issues around that. Obviously, we have the Matthew Perry tragedy, that happened, I guess, almost 2 years ago now. And there was some, ketamine involved in that. And so I think a lot of people start to think that maybe this isn't a safe medication. And so what we see is that ketamine is a very safe medication. It's really safe as an anesthetic, and certainly at the doses and the way we administered it at Derive, it's even safer. And so I think that that safety conversation just kind of comes around that if you're receiving an infusion with medical professionals in a safe clinic setting, that this is just an outstandingly safe and effective medication. But obviously, if you're using unknown ketamine from the street, in a club or bar setting or at home, then there can be a lot of risk associated with it. And so, ketamine really is kind of part of this journey towards healing. It's a little bit of a process, and so you really need to make sure you're in a place where you can be supported and cared for, and that there's people making sure your body's safe during that as well.
Well, it sounds like an incredible environment. What does the name Derive mean, and why did you name the practice that?
So as we were looking at naming for this business, we were thinking about, ketamine and really this kind of journey to healing that people have. That it's not just a simple, hey, you come in and get an infusion and you get better. There really is, doing some therapy and support, with people as they go through these infusions and are feeling better. And so we were thinking a lot about journey and, path to recovery and what that might look like. And so we really kind of started researching like what kind of names are there around travel and journey. And so I ended up coming across this really beautiful term, derive, which is a French term for a specific type of travel where the traveler kind of goes with the intent to just get lost in their surroundings and kind of come out on the other side changed with a new perspective. And it really fit well with what we do at Derive Health, I thought.
I bet that was exciting the moment you saw that word. You're like, bingo.
Yeah, it's
I
just so
love
beautiful,
that.
really a part of it,
I love that. Well, I see how excited and happy and joyful. What are you most proud of now that this business is up and running?
Just seeing the changes in our clients. And so, I've been an ER doctor for, I guess almost 15 years now. And so I've seen some amazing saves and amazing things happen in the ER. But even beside that, I say that this is the coolest thing I've ever done in medicine. It's just really amazing to see people that come in that are severely depressed, anxious, or dealing with severe trauma. And then a period of 6 to 8 weeks, we just really see these amazing transformations where they're really kind of coming out of their shell, they're healing. And, seeing the changes in themselves and their families as that happens has just been really super remarkable.
That is amazing. Well, tell our listeners how to find you and where you're located.
Yeah, so the easiest is to go to our website, which is derivehealth.com. It's spelled like derive, so DERIVE health.com. You can also reach out to us, ketamine@derivehealth.com is our email. And then our phone number is 980-221-2689. And you can call or text that number as well, and we can get you in and get you set up.
Well, Dr. Leake, this is a fascinating topic. I can tell you guys are passionate and very good at what you do. So we appreciate you joining us this morning.
Thank you so much for having us.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnpsouthcharlotte.com. That's gnpsouthcharlotte.com or call 980-351-5719.